Marhaba! Welcome to Pacu Project Awareness Caravan. Project title, Ana Ata Kalam, which derived from Arabic word which means I'm speaking, bridging the gap of communication among ORNA staff to enhance safe patient handover by utilizing Isbar process. Isbar stands for Identification, Situation, Background, Assessment, and Recommendation. Handover takes place in all different setup and across the continuum of patient care. Why communication and why Isbar? According to Norwegian Journal of Nursing published in 2019, communication failures in treatment teams are one of the most common causes of adverse event in specialized health service, and about 70% are due to human errors in non-technical skills such as communication, management, and decision-making. In medical setting, frameworks of communication such as Isbar have been developed to protect patient safety, save time, and to solve problems which was proven detrimental to patients or people's lives. Stewart KR 2017. The goal of this project is to improve quality patient care by enhancing safe patient handover and effective communication throughout post-operative journey of the and our objectives are to assure compliance with Isbar as a tool of complete patient handover guideline, to standardize the handover process among the ORNA staff using the Isbar tool, to increase the handover compliance rate by 79% to 90% among ORNA staff using the Isbar tool by the end of December 2021, and to determine areas for improvement and recommend solutions to close the gaps.
Let's proceed to cause-effect diagram, or known as the fishbone. The Isbar framework consists of 5 elements focused on communication, which includes on identification, situation, background, assessment, and recommendation. One of the causes under identification is comfortability of the staff and without interest or concern. Here we are not only identifying the patient, but we have to introduce ourselves. Next is situation. Situation means what is happening at this moment. So everything can be seen in Epic and unaware of essential information to be hand off. The third one is background. Job is specific, case was too short, and surgeons is busy, one of which is the intro. Fourth one is the assessment, unsure of responsible person to act, and quick handoff. And lastly, recommendation. Recommendation means what should be done to correct the situation. So order is not clear, surgeons delay, unavailability of orders during handoff. So all of this may lead to decreased compliance rate in Isbar.
Policies and procedure guidelines. Corporate policies and procedure can help us in safe handover. CPP number 1435-06 with the title of Handover of Patient Information is applicable to all KFMC staff. What is handover? Handover is the official transfer of professional responsibility and accountability for some or all aspects of care for a patient or group of patients to another person or professional group on a temporary or permanent basis. A communication tool that provides a framework for communication between members of healthcare team about a patient's condition is used. It is called Isbar. Isbar stands for Identification, Situation, Background, Assessment, and Recommendation. Each handover process must provide an opportunity for verbal communication between healthcare providers who are handing over and the healthcare providers who are receiving the patient. This communication cannot be ambiguous and must include at least the following information: code status, allergies, active problems, patient assessment, active medications, critical laboratory or imaging results that need intervention, all pending task and action needed, all laboratory results and scans need to be followed up and reviewed, a clear plan of care and responsible providers, all patients who are expected to deteriorate must be identified and have clear recommendations. The second corporate policies and procedure is CPP 1441-018 with the title of Post-Anesthesia Care Management, which is applicable to Pacu nursing staff, OR nursing staff, anesthesiologists, and surgeons. Pacu nurse shall receive immediate physiologic and psychological patient status report from the accompanying anesthesiologist and the scrub nurse. The scrub nurse will ensure completeness of surgeon's post-operative orders, review completeness of medication order, update discharge plan and enter management plan with measurable goals, and document patient and family education. The other CPP-related policies and procedures are the following.
OR to Pacu workflow of patient. Post-operative patient workflow. While the patient has ongoing operation in theaters, OR nurse will call Pacu to inform for any infection or special precautions of the patient. Once the patient was weaned off from anesthesia, there are two criteria. We have unstable patient and we have stable patient. We will be excluding the unstable patient for now, as patient will be shifted directly from OR to ICU. For the stable patients, anesthetists and OR staff will hand over the patient to Pacu nurse using Isbar. That includes status of patient, complete documentation in EPIC system, completeness of orders or requests of the surgeon or anesthesia. In the recovery phase, patient's vital signs and pain will be managed, and once the patient met the Pacu discharge criteria by using modified Aldrich score, patient will be reassessed and signed out by the primary anesthesia team. Then Pacu staff will call the corresponding receiving ward for fetching the patient. During the handover of Pacu and ward, Pacu nurse to hand over the patient to ward staff using Isbar. That includes current situation of patient, complete documentation in the EPIC system, and completeness of orders or requests by the surgeon or anesthesia.
Now we are presenting OR to Pacu audit tool which we revised. Isbar we can see the 5 main components and its 16 criteria. Under identification there are 2 criteria: introduction of oneself and identification of patient's name and MR number. Second component is situation. Under this there are 4 criteria: allergies, chief complaint or diagnosis, patient comorbidities, precautions which is infectious or surgical related. Next is background. There are 5 criteria coming under this. They are operative procedure or operative notes, type of anesthesia, medications administered including dosage and time, intake and output includes IV, blood loss, urine output, and significant events which is anesthesia or surgical related. Fourth step is assessment. It has 3 criteria: level of consciousness or pertinent vital signs, line and dressing or dressing assessment by using LDA avatar, skin integrity checked by both nurses. Final step is recommendation. It has 2 criteria. They are ensure that immediate postoperative orders are completely accomplished in EPIC, completeness of postoperative documents in paper or EPIC.
Good day, I'm Sharmala. Let me explain to you what is definition sheet is all about. In a simple explanation, it means the research method used in this project. As you can see, the target measure of this project is to measure the handover compliance rate from OR to Pacu. Why are we doing this measure? The Pacu unit intention is to improve the handover process by outlining the important components required during the handover. So, how do we do the calculation? Definitely there is a formula, which is numerator divided by denominator times 100. Numerator will be number of theatre nurses complying with 100% Isbar components, and denominator will be total number of participants observed for the entire month times 100. In order to start the study, we have decided to take only 20% of the total census in Pacu. All elective cases hand over to Pacu from OR theatres will be the inclusion criteria, and post-operative patient from OR to ICU, OR to Pacu ICU, aborted cases, and all local anesthesia cases will be under exclusion criteria. All nurses who complies the minimum of 13 out of 16 criteria is considered 100% compliant. As you can see, these are the 16 criteria in the Isbar form. According to our study, there is an increase of 5.43% of improvement in the second quarter of the year compared to the first quarter of the year. Let's see the results in tabulation from the study from the month of January to June. This is the first criteria, which is self-introduction and identification of the patient. We found that the nurses have the highest compliance in identification of the patient compared to the self-introduction. It is actually very important to introduce ourselves because it is a concern of reliability. Let's see the second component, which is the situation. There are 4 criteria. Highest percentage is the allergy criteria, which is very, very good. And lowest is the infection or surgical precaution. Endorsing regarding this precaution is very essential for better understanding of the Pacu nurse regarding patient's condition for them to provide an effective post-op nursing care. This slide shows the third component, which is the background, consists of 5 criteria, as you can see. We found the highest compliance is on endorsing about the operative procedures. Well done. And lowest criteria is regarding the significant events for either anesthesia or surgical side. Pacu nurses needs to know if there were any significant events happen intraoperatively in order for them to continue the nursing. The fourth component is the assessment, consists of 3 criteria. The highest is the checking of the skin integrity, and the lowest is the LOC and vital sign of the patient. Let's work on it. The last but not least component is the recommendation, consists of 2 criteria. The highest is the completeness of the document, and the lowest is the post-operative orders. We often find it is always either not completed or delayed, which could delay the continuity of the post-op nursing care. This is a table showing the handover compliance rate from OR to Pacu, where the number of opportunities taken from the 3 main units, which are the main Pacu, Pedia Pacu, and WHH Pacu. In this graph, you can clearly see that in January, the percentage of nurses whom are 100% compliance is 3.96%, and it increases gradually till March, which was 11.45%. But unfortunately, it reduces for 2 consequent months and increased tremendously in the month of June by 4.12%. A very good improvement, and let's work together to improve every month till we achieve the target. We are glad to announce the compliance rate in the second quarter of the year has increased from 7.57% to 8.44%, which is a positive improvement of 0.87%. Bravo to all!
On behalf of Pacu UBC, we are grateful to our OR management, our facilitators, and to each and every OR staff and Pacu staff for helping us achieve the goals and objectives of the project, which is to improve the safety of the patient per-operatively. Thank you, everyone.